and welcome to another episode of Tea and Tales, the podcast where we talk about vets, pets, true stories, all over a good cup of tea. I'm your host, Megan Taylor, and with me today is Dr. Ramona from our Modern Vet JVC Ranch. Welcome,
Good
and thank
morning.
you for coming
Hello.
to talk to us.
How are you?
Good, thank you. So today we're going to talk about one of my favorite topics, senior pet care. Because so many people, they get a new puppy and it's like, okay, what to do if you have a new dog, what you have to do if you have a new cat. But we never speak about like, okay, in 10 years.
Yes.
And it's different. Whatever you're doing for your puppy and your kitten is completely different in 10 years what you're doing for your senior pet.
100%.
So before we get too much into the whole topic, can you give us a little introduction about yourself and why this topic is so important for you?
Yes. My name is Dr. Ramona. I graduated in 2014 and I've been with Modern Vet for the past 2-3 years. I love companion animals, basically cats and dogs, and that's why I dedicated my career to help them out as much as possible and be a good source of knowledge and information to pet owners at every stage of their pet's life. Okay.
So for a lot of people, they don't understand at what age their pet becomes a senior. So can you let us know, when do we start to consider pets senior?
Yes. Generally speaking, for cats, we would consider them seniors after the age of 11 years old. Small breed dogs also at around 9 or 10 years old. Large breed dogs, they age faster, so they are probably seniors at around 6 or 7. Now, this is a generalized categorization of the senior age, but at the end of the day, it all depends on the health condition of the animal, the breed, the predisposition to certain diseases that progress with age.
Yeah, because I feel like a lot of people like to put their head in the sand and they don't like to, even myself, when I was preparing this podcast, one of my dogs is 7 and I was like, oh,
Are you
technically we need to have this discussion. He's a senior. So do you find that a lot, like a lot of people will come in with their dog who's 7 or 8 and you have to kind of have that conversation with them like, look, we're talking about a senior pet now. There's a few things we need to think about differently.
Of course, whenever I have a senior patient coming into the consult room, it shifts my whole mindset and my whole approach to the visit. So instead of asking the regular normal questions that I ask, I make sure that the client is aware that this pet is becoming a senior and you should be aware of this and that certain stuff that in young animals you wouldn't see and you can brush off lightly if you want. If a 5-year-old dog vomits once, it's fine. But if an 11-year-old dog vomits and he doesn't have good appetite, that's an alarming sign. So yeah, it changes the whole mood in the consult room when I have a senior patient.
And it's interesting, you also spoke about the breeds, and I think that's such an important thing for people to think about. If you know you have a purebred dog, to be aware of kind of because they will be common kind of things that they will be getting when they become seniors. So if you have, like a Cavalier, you need to start thinking about or be proactive about checking for the heart, or the Labrador, you need to be proactive. Like there's a high risk he's going to get arthritis.
I think it's mostly that it's the vet's responsibility to let the people and let the pet owner be aware of these things when it's the right time to be. Usually I mention it when I first have a Cavalier puppy, for example, or a Cavalier pug or a French bulldog. Even as a puppy, I just say this.
Just so you know.
Just so you know, this breed is predisposed to this and that and that and that. At a certain age, you have to be aware of what you should be doing, and you have to be capable of
like there might be
doing
some tests we need to do, and that's.
And I always ask them to have these pets insured, have medical insurance for them, because they are some conditions are pretty expensive for someone to handle them all of a sudden. Yeah. So it's really a good idea to have these pure breed dogs who have the predisposition to certain conditions, to have them insured under a good policy all their lives.
Yeah. So if people are trying to think about how to help their senior pets, let's talk a little bit about nutrition and the role that plays in kind of helping our senior pets. So the food that you're giving them when they were 5 years old might not be the food you should be giving them at 10. Or more importantly than that, I feel like a lot of dogs start to gain weight when they're older, and this is a quick way of them kind of losing years from their life. And a lot of people will also be like, well, it's the same food I always fed him, but it's
the lack of activity.
Yeah, and this dog doesn't need the food that it was having at 2 years old, like running around. So tell us a bit more about the role nutrition plays in
terms of food. We have their senior pets do need a very good source of protein, something that's easily digestible, easily absorbable, in order for them to keep those muscles that they have, because the muscles will protect the bones, and they protect the nerves, and they protect the joints from any fracture or possible injury. So yes, food is a very important factor in that. But the other important factor in that to prevent the obesity and the weight gain is that unfortunately I see this a lot in the clinic. Whenever I have a senior patient, most of the times the owner is not taking them and is reducing exercise because he's an old dog.
Yeah.
So I don't think getting old or age is a reason to stop the dog from exercising or from training. We will talk about that in more details in a while. But dogs have to have the exercise they are used to having on a daily basis without stopping, regardless if he is 12 or 11 or just 8 or 9. They should be always exercising to prevent the weight gain.
Yeah, the mobility is such a great way to keep your pet young.
True.
It's like same as you want to
Same
act like
as
you're
in
90 years
humans.
old, you're going to feel 90 years old.
100%.
Stop moving
You can
completely.
be 30 and living the life of a 60 or 70 years old because you're not doing enough exercise for yourself. So yeah.
So you spoke about the kind of weight control. Is that an issue you see in the clinic? Like a lot of older dogs are usually
Obese.
a little overweight.
Honestly, it's not only older dogs. It's those breeds that have the tendency to gain weight and they use their puppy eyes for more treats and more food.
Yeah, and I think
whenever you
owners
look at
kind of
them.
feel sad, like he's a
And-
little old dog. Like let me just give him
but
some extra food.
It's not sudden. It's
Yeah.
not sudden. Like, oh, now he's 10. He's gained 2-3 kilograms more. No, it's not. It's not that. Usually, it happens progressively.
Totally, yeah.
Progressively, the exercise time goes down. The exercise intensity goes down, and of course, even if you're feeding the same quantity of food, he's gonna gain weight. Now, it's worth mentioning also that there are some medical issues that cause this unexplained weight gain in dogs, especially thyroid problems,
Right.
hypothyroidism. It is one of the things that it doesn't show any symptoms. They only come with us for concern of he's a bit slow, he's gaining weight, even though I'm feeding him the same quantity. After the
subtle.
age of 6 or 7 years old, it's worth checking the thyroid function. 'Cause
Okay, so you would
it's a
tell for
very
most people
common-
are getting these kind of symptoms.
Yes,
First
it's
step,
very
check the
very
thyroid.
common in,
Yeah.
in
And is it more common in
dogs.
dogs or cats? Or
Hypothyroidism is more common in dogs. Hyperthyroidism, which is the exact opposite, it's more common in cats.
that's
In
interesting.
hyperthyroidism, cats will eat the same, but they are losing weight. Will eat the same quantity, same appetite, same everything, but they lose the weight and they lose muscles.
Yeah, a lot of people come in with the skinny cats when they're old, and then the big dogs.
It's one of the possibilities, definitely, is hyperthyroidism.
So a lot of people think the pet looks fine. He's 7, 8 years old. I don't see any outward problems. Do you still recommend like you need to be coming in for yearly checks, or how do you approach
I
that?
insist. Really, no, I not just I recommend, I say it 3-4 times during the consult.
You're coming back here.
Exactly. Let's schedule the
Yeah.
next appointment.
Because that's where a lot of people fall into this kind of misstep. Like he looks
True.
fine. He's not. No, I haven't noticed anything. Do I need to?
Unfortunately,
on
they
things?
wait until they start seeing signs. But what they don't know is that as the age progresses in dogs and cats and humans, internal organs will no longer function as they would if they were younger. So the heart will not function properly, the kidneys will not function properly, liver, pancreas, all of that they will not function as much as they will not have the good functioning capacity that they had when they were younger.
And it's like you
However-
said for the kidney. That a lot of time,
for
if you're going to wait
kidneys.
for the symptoms,
It's definitely too late.
yeah,
To wait for symptoms for any kidney disease. For the kidneys, they have 2 kidneys. So one of them will start compensating for the lack of the work the other is doing, and vice versa. So we will not see any symptoms on the cat or the dog unless there is irreversible 70 to 80% damage in those kidneys. So there's always a minimal blood test that can be done to see what's happening, to detect a problem that's starting to happen. And one thing about cats don't show any signs. Really,
No,
cats,
they really
they
don't.
have this predatory behavior that they don't show their weakness, because in the wild they are predators. So they don't show their weaknesses until they cannot handle it anymore, regardless of the condition. So it's really important in cats to have these general blood tests every year. I'm not saying every 6 months. Every year is good, starting the age of 8 or 9, just to know where we're going, just to know what to predict.
yeah.
What-
And another good key point is maybe you can do this less frequently, but from a younger age as well, to understand your cat's baseline, because you
100%.
don't know at the age of 8 or 9, like
True.
what's
There
changed.
are some criteria. There's always a normal range
Yeah.
in all the indicators of kidney function and liver function. Some cats are normally on the higher end of the range. Some cats are normally on the lower end of the range.
Exactly.
So yes, it's good to know what's the normal for this cat, so that we know what's the abnormal and when it is abnormal and alarming.
Right. So you've said the yearly blood test. What else can we think about doing?
Urine analysis
Urine
is
analysis,
an
okay.
excellent. It's a very simple test that we can get the result for it very fast, but it gives us lots of information. It gives us an idea of how the pancreas is working, how's the glucose level in their body. It gives us an idea how much the kidneys are able to filtrate protein and filtrate residues from the food and the water. So it's just a simple test that in 10 minutes we have the results, but we have more answers as well as to what's happening.
And even I think for the cardio check, even for my own dog who's now 10, recently Dr. Tatiana, like I came in for something small, and then she was like, he's getting a little senior, like, while you're here, let's just check the heart. No symptoms at all, but then once we do the scan, yes, you understand that actually he has the first stages of this kind of valve failure, and we have to now check it every 6 months. But if we had waited until
Until he
2
starts
years,
coughing,
until he has he's
or he
shorter
starts
breath, or
panting, exactly. And this is what happens usually. The clients will come in that, hey, my dog cannot walk 5 steps, and he starts panting or he starts coughing.
yeah, like we're really quite late stage now.
That's advanced.
Right.
That's advanced.
So we spoke a little bit about it earlier. Movement, so important as a vet physio, obviously.
Yes.
I find it extremely important.
Hydrotherapy especially. Yes, it is. Actually, movement in all its forms, whether you're exercising him outside, exercising him indoors, taking him for physiotherapy and for hydrotherapy, it's all important. It's as equal as anything. So it's really beneficial to keep them moving and to keep them active physically and mentally while we're discussing this. If you want to go through it now. Mental stimulation and mental exercise is as important as physical exercise to the senior pets. We cannot stop encouraging them and training them and teaching them new stuff. It's really important. We might want to do it at a slower pace maybe and give more treats and more rewards back, but it's important to do it to keep their mental status also alert and aware of everything that's happening. Because another problem other than the physical problems they go through cognitive decline as well. So the dog or the cat might stand in the middle of the kitchen staring at the wall, for example.
Yeah, a lot of people kind of don't realize that kind of dementia or cognitive dysfunction can happen in pets.
100%, and it's very similar to humans, to Alzheimer's in humans. Maybe they start barking unnecessarily here and there.
And I think the restlessness is something that really confuses people. They're like, he seems active, but he's not quite settling into himself. They're just up and moving and a bit lost in themselves.
Yes. It's very important. And there are things that can help prevent that or control it as much as possible, which are training, puzzle mats, just keep training and mentally stimulating them, like going on different routes and introducing them to more smells on while they are walking.
Yeah, by the time they're 10 or 11, maybe you get into a bit of a rut with everything, but it's like they're never too old to kind of learn something new or to go to a new place.
True.
All within their kind of boundaries of what's appropriate for them at that age, obviously.
Yes. But it's not a reason not to do that.
Yeah.
Yeah, so age is not a reason to stop training. It's not a reason to stop exercising. It's not a reason to brush off a vomiting episode or a diarrhea. Age is not a reason to do that.
Yeah, or he's limping, or he's in pain, or he's not eating, and it's like he's just old.
You have 2 dogs, right?
Yes, I have 2
like
dogs.
one of them is a senior and the other one is a young adult. If both are limping, would you take one and leave the other?
Yeah, but that's so common in people, and they kind of don't even see it as a sign of pain. Like it's just he's just old, he's just limping.
No, it's definitely painful. Any limp is painful.
And so many people, I think, they see in hindsight with their older pets, they're taking them for their walks. Because to go back to movement a little bit, keep the routine is most important, I think.
Yeah.
Keep them moving, but understand your dog's boundaries as well. If you see them sitting and if you see them stopping every few steps, they're trying to tell you something. There's something
100%.
discomfortable. So
Yes,
you do have to sometimes change it to what they're comfortable doing. And I see a lot of people as well kind of fall into the drop of like, I'm free on the weekend, so like let me take them out hiking, let's go running, like get some movement, but needs to stick to the routine.
All the week he's not moving five
for
meters.
5 years didn't do anything, and now he's old.
And now he wants to go hiking on a weekend. Yeah, it's too much. I mean, stick to the routine that you have with your dog for the past 10, 11 years. Just stick to it and stay consistent because they need it. They need it. Again, age is not a reason to stop the good habits and the good routine.
Exactly. And we spoke a little bit about the aging brain and dementia and kind of the Alzheimer's.
The cognitive decline. Yes.
Is there, what else can people do at home to help this? Is there supplements? Is there...
Definitely, yes. There are safe supplements to use and high quality supplements, same as in humans. There are vitamins and supplements that are very commercial, and there are ones that are really good from good sources. And of course, there's a price difference between both. So as in humans, we have in pets supplements for seniors, mainly glucosamine, chondroitin, omega complexes. All of these supplements,
And sorry to chime in, but if you know you have a lab or you have a breed that's prone to this hip problems, there's no problem for you to start these supplements before they already have really sick and severe arthritis. Like these supplements you can give from a young age and try to...
You can start with them at the age of 5 or 6 years old, especially when you have an obese young dog, for example, 5 or 6. You would put them on joint supplements, definitely, because all of this weight is falling on their joints, on their legs and their front limbs. So it is a good idea to put them on these supplements while you are exercising and you are on a weight loss plan.
Yeah. Yes. Other things people can do at home if we're thinking like for your senior pet.
There are these non-slippery mats.
Yes, and in Dubai, everything is tiled, everything is slippery. I say to all of my patients, like if there's a room he's mainly in, like we need to put carpet or the yoga mat, something that they're not just like struggling to get up and slipping on the whole time.
Yes, and they can also use orthopedic beds to make it easier for dogs to sleep or stand up after a sleeping position. And what else? Yes, use ramps or stairs to go up the
These small changes in the home make a huge difference. Like 100%. The daily activity that they keep kind of struggling with. If you can make it a little bit easier.
100%. So instead of the dog avoiding to go on the sofa, he would go slowly. It will strengthen his muscles. It will strengthen his nerves and tendons. So better, good. Do it in a safe way rather than having him wanting to jump and asking for you to carry him on the sofa.
Let's get a little bit into the senses. So most people don't realize, but if your dog, you're lucky enough to have a dog that lives into its lovely old age, they will start to lose their senses.
100%.
Like the hearing, I think.
The hearing and the vision, they gradually decrease and they gradually decline. And,
do you get a lot of people also asking, how do I know if he's just not listening to me? Like a lot of people are like, I don't know, is he just becoming like an old grandpa and he doesn't want to listen?
No, but usually dogs respond. It's cats that will not even twitch.
They're always a little bit upset here, like, no, their hearing is fine.
They just decide not to answer to their name even. But yeah, in dogs it's easy. I mean, when you're living with a dog, you will know that usually he used to react to the sound or to the doorbell ringing or to the phone ringing.
Or you now get the leash to go.
Exactly, the leash and the food and the sound of the food and the plate. So yes, dogs are more honest in showing you that there's a problem. Even with the vision loss, and sometimes they bump into walls or they walk right next to the wall. They don't want to be in the middle of the room. So yes, senses also decrease with age. And one way to make that easier for dogs in the house is to try not to change the furniture as much as possible. Don't put new furniture or new pieces. Don't move them, especially their important points where there's their food bowl, their water bowl, their bed. Try to keep them the same place as they are. Another thing you can do is you can use some safe essential oils like lavender and dab a little cotton ball and put it next to those important sources so that they can smell it and they can approach their food or approach the water or their bed so that they know where it is.
I think it surprises people how well they will actually know the layout of the house. Like they can get around completely fine. They can live a good life still.
As
but
long
just
as
don't
it's still
be
the same.
this new furniture.
Exactly. As long as it's the same. Another thing, you can avoid the sharp edges of and the corners of sofas and tables. Use the shock absorbers at the corners. These are nice in case they bump into them. And another thing, just keep them safe where there's no risk of them falling off the stairs. Use the baby gate to avoid them.
Stairs you need to be cautious with as well.
Yeah.
So we've spoken about what people can do at home to control it. We've spoken about weight control. Where is kind of modern medicine going with it? Like, what can people do or ask their vet about?
Yes.
The controversial one,
yes.
Librela, is recently kind of quite in demand. What's your opinions on Librela?
Honestly, it's giving a very good response, and we're seeing really good reactions to dogs after these injections. They are making their lives even better and with the minimal side effects. Now, there's nothing that is completely side effect free and risk free, but definitely we have to weigh the pros and the cons of everything. But from my experience, these injections are doing really good, especially when they are accompanied with good exercise, good physiotherapy routine.
Love that you said that, because from a physio point of view, my only maybe controversial opinion on Librela is some people, they take an injection, it's an old dog, and they have a lot of joint problems. Now they don't feel, they feel great and they're flying around the place. And then like 2 months later, it's like they've done a lot of damage to themselves because they haven't gotten stronger. They're just feeling great. So you need to kind of put it together with kind of a fitness plan or a regime.
100%. Because the pain control is very important, but it's 50% of what can be done for these animals. We cannot just count on the medications all their lives. It's not fair. It's not fair, to be honest, because there's lots of other things that can be done, and muscle build up, muscle mass is the most important part of the dog's body. So we need to take care of it, nourish it properly, and keep them well for a longer period, so that they don't need the injection every 6 weeks or every 4 weeks. They will need it every 12 weeks, for example.
Yeah, and it's like you said as well, the goal is not just to live a long life. It's to live a long, healthy life where they're able to have comfortable.
Yes,
exactly.
And luckily, with the advanced medicine that we have, we are able to stretch out the lifespan of dogs, to be honest. And it's different now, especially in cats. Nowadays, we are surprised if the cat dies before the age of 13 or 14, really. Previously, it wasn't this case. Previously, at 12, 11 maximum maybe, but nowadays, no, cats are thriving to live longer.
That's the goal. I'm like, mine better be living another 15 years, by the way, the medicine keeps going. So I want to get into a little game we have, Vet Mythbusters, okay?
Yes,
so just a fast fire round, truth or fiction, okay?
All right.
Truth or fiction? True or false? Let's
Myth or fact?
Perfect. Okay, number one, my pet's slowing down because they're old, and that's normal.
It is normal, but it's not normal to just let it go. It is normal as the dog and the pet will age. Lots of things will change, and their capability of cellular regeneration and the functioning of their internal organs is changing, but we should be aware of that because you care about your pet.
Yeah.
So it's not a reason to ignore it, to ignore what's happening. It's a reason to
address what the problem is.
To address the problem, 100%.
Exactly. Myth number two, senior pets need less protein.
Actually, senior pets need a better source of protein, a better digestibility of protein, better form of protein than young animals.
Thank you. There's no point in treating older pets. They've had is this a myth?
This is not a myth. This is an unfair.
I'm so sorry. There's no point in treating older pets. They've had their time. True or false?
To be honest, unfortunately, I get the vibes of this sentence a lot in the clinic. Unfortunately, like I noticed someone coming in with a 16 or 17-year-old dog. Nah, he's just limping. It's just old. Nah, what to do? He's just old.
Yeah, true. Actually, you always say he's just old.
And yes, and they don't. And it's not like they're sending me signals like what to do, what can I do to help him. No, they're just shut off completely. Like he's just old. No, there's nothing to do. But I always answer that.
There's so many things to do.
Exactly. I tell them, yes, I know he's old, but there are some things to be done.
Which should be like a positive, like, don't worry,
exactly.
we can fix something about this.
But when you see someone giving you those eyes, and no, there's no point, and what to do?
It's not true.
It's not true, yes.
Myth number 5, arthritis is just stiffness, not pain. Oh, that's a common one.
Yes, that's very common. Yes, especially when they start to limp and when they become just slow, not limping, just slower in
really
movement.
get up. Doesn't seem like he's in pain though. Like he can't stand up.
No, but it is
you
very
know for
painful.
yourself, if you cannot get out of bed,
it is very painful.
Pain.
Yes. There is no such thing. Arthritis equals pain 100%. There's no painless arthritis.
Yeah, thank you.
So the dog or the cat doesn't have to be vocalizing or making sounds or moaning in order for you to know that he's in pain. Once you see that he's not acting normally, he is in pain.
Yeah. Last myth. Older pets can't learn new things.
Yeah, that's very common also. Actually, they can. They still have the ability to learn and to be trained and to learn new stuff. Maybe when if their hearing is declining or their vision is declining, it's not always the sound. Sometimes just a gentle pat or gentle tap at the shoulder will teach the dog new stuff, like when to sit, when to stay, when to sit, get up. Maybe these things will be learned at a younger age. But it's nice to do something new with a senior dog. It doesn't have to be a command. Sometimes just a new treat, to put it like somewhere where he hasn't had it before, like I don't know, like on these rubber mats, for example, and for him to eat it, and then give him a new toy, squeaky toy or a ball. It's really nice. It's
It's not just they should.
They can 100%.
Can and should.
And this is what will prevent them from going into this cognitive decline. When they are mentally trained and mentally stimulated, it will slow down the progress of Alzheimer's, if you want to say.
Yeah. So we've proven all of those were wrong.
All of them are myths.
Please don't believe them.
Not a single fact on your list.
So is there any takeaway you want people to know, like the main kind of takeaway from senior pets?
Yes,
you could tell people just one thing.
course.
What's something you would love for them to follow on with?
First of all, I highly recommend that whenever you have a pet that's going into seniorhood, book a consultation with your vet to know about the next stage. Just like you book a consultation when you first have the puppy and you first get a kitten, hey, I want to know what's happening. This is a life-changing stage. It is the last stage in their lives. You want to know what's happening. You want to know what to expect. You want to be aware of what's happening with your pet, because their behavior will change. Their habits will change. Everything will change. Even their diet has to change. So please, treat your senior pet as well as you'd have treated him when he was still young, a kitten or a puppy that you just bought and brought home or adopted or anything. Age is not a reason to ignore anything in your pet's life. It's not a reason to ignore slow behavior or slow behavior or a different behavior or something strange happening with your animal. Don't wait until you see any symptoms. Have a vet consult your senior pet as soon as you know that he is in these gold years.
Yeah, golden years. Dr. Ramona, thank you so much for coming to talk to us.
Thank you,
And
Megan.
I hope you as pet parents, you found it helpful. Please remember to subscribe and definitely leave some comments if you want Dr. Ramona to answer anything, or if you have questions. We will try our best, of course, to answer them.
Okay.
Thank you again.
Thank you.
Thank you.
Thank you. Oh,
You're so good, Ramona. I like it when you come on. No, it's so it's fine. The mood is very light. It's nice. Who's calling me?